So, you're thinking about orthopedic surgery. It's totally natural to focus on the operation itself, right? But what if I told you that's actually one of the shortest parts of the whole experience? Today, we're going to look at the entire journey, from the moment you decide to go for it to the day you're back on your feet and feeling stronger than ever. If this is on your mind, you are absolutely in the right place. We're going to walk through the whole story, not just one chapter. Because when you see the full picture, it stops being this big, scary thing and becomes a clear, manageable path. A path that gets you back to living your life. Let's dive in.
All right, so every journey has a starting point. And for this one, it's figuring out if surgery is even the right choice. So what are the signs? What are the things that tell you and your doctor that, yeah, this is the way to go?
You know, surgery is almost never the first idea. It's usually the last resort after you've tried everything else, what doctors call conservative management. So we're talking about things like physical therapy, injections, medications. But if you've done all that and you're still dealing with serious pain, or you just can't move like you used to, or your joint feels unstable, well, that's when surgery becomes the conversation. It's about getting your quality of life back.
Okay, so the decision's been made. You're moving forward with surgery. Now comes a really crucial part, getting ready. And the best part is, there is so much you can do to set yourself up for a win before you even walk into that hospital. This is your chance to get your body and your mind prepped for a fantastic recovery. Your prep really boils down to three main things. First, a good exam to see exactly where you're starting from. Second, education, because knowing what to expect is half the battle. And third, exercises to get your body strong for what's coming. These three things, working together, can make a world of difference.
And here's why that education piece is such a game changer. It lets you learn and practice the exercises you'll need to do after surgery, but you get to do it before you're tired and sore. It's like getting a cheat sheet for your recovery. You're building that muscle memory when you're feeling good, which is just a huge advantage.
Think of it like this. You wouldn't just wake up one morning and decide to run a marathon, right? You train for it. And it's the exact same idea with surgery. Doing exercises beforehand builds up your strength, so when you come out of the operation, your body's already prepped and ready to start the real work of recovery. All right, you did the prep work, the surgery is done. And now, the next chapter begins, recovery. But this isn't just about waiting around to feel better. Oh no. It's an active process with different phases and clear goals that are designed to get you back to 100%.
This timeline is basically your roadmap. It shows you how you'll progress from that initial stage where we're just protecting the repair all the way to that final awesome phase where you're getting back to all your normal activities. It's a step-by-step journey.
So in phase 1, the maximum protection phase, the name says it all. Our main goals are to manage pain and swelling, prevent any problems, and start some really gentle movements. We want to stop things from getting too stiff without stressing the surgery site. It's all about creating the perfect environment for healing. Then, as you heal, you'll graduate to the moderate protection phase. Here, we start to carefully push the boundaries a bit. The focus shifts to getting more of your motion back, making sure the scar tissue is moving well, and really importantly, starting to rebuild to strengthen those muscles.
And this is the phase where all the hard work really starts to pay off, the return to function phase. We're aiming to get you back to full mobility, building maximum strength, and fine-tuning your balance and coordination so you can get back to doing everything you love, safely and confidently. Now, we have to talk about potential risks. And I know that can sound a little intimidating, but it's not about being scared. It's about being smart. Because when you understand the risks, you can be an active partner in helping to prevent them. Knowledge really is power. So let's talk about one of the common ones, DVT, or deep vein thrombosis. It sounds complicated, but here's an easy way to think about it. It's basically a traffic jam in one of your deep veins. And just like a traffic jam, it can cause problems. But the good news? It's very preventable, and we know how to keep that traffic flowing.
Of course, certain things can make you more likely to get one of these traffic jams, like being off your feet for a while after surgery or having a history of clots. But don't you worry, your doctors and nurses know all about these risk factors. They'll look at your specific situation and make a plan just for you.
So, how do we prevent a DVT? Well, it's actually pretty simple stuff. Getting up and walking as soon as it's safe. Doing little exercises like pumping your ankles back and forth. Wearing special stockings. Drinking plenty of water. All these little things make a huge difference in keeping your circulation moving smoothly.
Okay, we've gone through the whole process, the decision, the prep, the recovery, even the risks. But now we need to talk about the single most important factor in all of this, and that, my friend, is you.
I want you to really let this sink in. Your surgeon, your physical therapist, they are your expert guides. They give you the map, but ultimately, you are the one driving the car. Your commitment, your hard work, your self-management, that's what turns a good surgical result into a great one.
Think about it this way. The surgeon's job is to repair the broken part, but your job, your amazing, powerful job, is to rebuild the function. You are the one who teaches that part how to work again, how to be strong, how to be a part of your life. You are the leader of your recovery team. So the only question left is, are you ready?